Why does South Korea's graph of new cases look like this, while the US's graph of new cases look like this? The main answer, contact tracing. Hey guys, it's Anika from Combat COVID here. Today I'll be discussing contact tracing for COVID-19 and how it can be used to curb the spread of the disease. Now, let's examine our original question a little more closely. Although South Korea was one of the first countries with the large outbreak and has many urban centers, it was able to greatly limit the spread of the coronavirus using digital contact tracing. A recent outbreak in Beijing was also halted due to the aggressive use of contact tracing. In addition, a study from Shenzhen, China, showed that when compared to symptom surveillance, those who were part of the contact tracing program isolated and received hospital care earlier. Contact tracing also played a key role in containing the 2003 SARS-CoV-1 coronavirus outbreak. In fact, a recently published paper reported that contact tracing may reduce the R0 value, or the number of healthy people one contagious person will spread the virus to, from 3.11 to 0.21, enabling us to curb its spread. From past pandemics and the current one, we can conclude that easily accessible SARS-CoV-2 testing, contact tracing, and self-isolation are necessary to contain the current pandemic. Now that we know the role of contact tracing in curbing the spread of COVID-19, let's talk about how contact tracing is executed. As the name suggests, contact tracing is a tool used to prevent the spread of disease by identifying and isolating patients and people who they have been in close contact with. Contact tracing consists of 4 main steps. The first step is known as case investigation, and it involves public health officials working with patients to identify everyone they may have been in close contact with. For COVID-19, a close contact is defined as any individual who is within 6 feet of an infected person for at least 15 minutes, starting from 2 days before illness onset until the time the patient is isolated. Public health officials then contact those identified by the infected patients and notify them of their risk of disease. Next, contacts are provided with support and resources to help them understand their risk and are informed of what they should do to isolate themselves and how to monitor themselves for illness. During this process, contacts are also informed about asymptomatic transmission, or how they might be spreading the disease without even knowing it. Additionally, these patients are often referred for testing. Lastly, these contacts are encouraged to self-quarantine, monitor their health, and practice social distancing for at least 10 to 14 days after their exposure to the infected patient. However, when an outbreak in a region becomes too large, such as in Florida, contact tracing may become difficult and even unfeasible. The following graphic provides a useful timeline of what contact tracing looks like. For more specifics about contact tracing, as well as priority testing criteria and contact resources, please visit cdc.gov. If you enjoyed this video and would like more updates about the novel coronavirus, make sure to like this video and subscribe down below, and visit combatcovid.org. Thanks for watching!